Professor Donna Ferriero, visiting speakers, dignitaries, ladies and gentlemen, good evening. I deem it my privilege to be here today for the 33rd TS Srinivasan Oration. This marks yet another milestone in the series of lectures that we've had for the last 33 years. This whole lecture series started thanks to Dr. Krishnamoorthy Srinivas, who wanted to commemorate the memory of my father by having this series of endowment lecturers in order to contribute knowledge to our society. My father had a great and abiding interest in medicine and having suffered from neurology in particular, and also for medical care to the underprivileged of our society. And that is how this lecture series came about, and it has expanded and grown under the dynamic leadership of Dr. E.S. Krishnamoorthy, who holds the TS Srinivasan Chair in VHS, or Voluntary Health Service, into a hub of community-based professional training, neuroscience research and health policy. And this attracts students from all parts of India and overseas, and to the dedicated TS Srinivasan Institute at VHS. Several fellowships have been hosted by the center and supported by international organizations, renowned universities, and right now we're talking about new collaborations with Australia and US universities. The visiting professorship, we believe, has had the ability to inspire young physicians and researchers by providing opportunity to engage them in meaningful conversation and debate with the best scientific minds in the fields of contemporary interest in neurosciences. The orators who have come here have not only given this lecture, this is only actually a small event, but have taken part in workshops which has been attended by students as well as practitioners of neurology, and therefore these workshops have become quite a significant event in the diary of neurology in India. In the last 9 or 10 years, the TS Srinivasan Institute of Neurosciences has also been engaged in postgraduate education, MS in neurosciences, as well as PhD. Till date, about 85 masters in neurosciences have graduated, and several students have been drawn into collaborative clinical neuroscience projects in translational areas. This department is affiliated to the Dr. MGR Medical University, and we conduct a 4-year program for PhD in neuropsychiatry, disability, and health policy. The last couple of years, 5 students have been enrolled in this program, and the research studies promise to generate abundant, relevant data on diverse areas, including neuropsychiatric comorbidities, the caregiver burden, and the rights of persons with disability. As India is aging, we see a lot more cases of neurological problems. Many years ago, when we started this program, and lecturers used to come and talk about Parkinson's or Alzheimer's, people used to say, we don't know these diseases in India and they're advanced society diseases. But the lecturers, as they said, you would see more of it as you have increased longevity and lifespan, and today we see a lot more of these. We also offer a 1-year fellowship in neuropsychiatry, and here the fellow is able to learn by patient's bedside through research inputs, by active participation in the academic sessions of the department, or discussing the rationale of the treatment with his colleagues. We also have MD in psychiatry students from Sir Raja Muthia College, Annamalai University, who have undergone their 3-month peripheral posting in neurology in this department. This year, the clinical and research wings have consolidated over 3.5 decades of assiduous work by developing a sustainable and replicable Indian rural-urban model of clinical healthcare delivery. An integral part of this project is in the multidisciplinary clinical wing of the neurology department, with over 2,500 outpatients and 200 admissions a year. Stroke is a major public health priority and has been covered by this institution from the beginning, not only to treatment of the stroke, but also post-treatment care. And this particularly has focused on the lower socioeconomic strata of our society. Through the Center for Advanced Rehabilitation Specialties, or CARES, we have provided a unique low-cost rehabilitation policy program, and this has been recognized by WHO in the health report as a best practice model for serious and debilitating conditions like dementia. Maximizing ability through comprehensive health care is another novel community-based initiative, and this covers children with developmental disability and to the community and institution-based elderly. The neuropsychiatric clinic has been set up recently to establish the continuity between neurology and psychiatry. The TS Srinivasan Research Group, with 4 PhD staff, 5 PhD scholars, MS students, and researchers and interns and mentors, have focused their research studies on the interface between clinical science and public health to further strengthen the focused drive to create replicable clinical healthcare delivery model. There is a promise that all these spokes of the wheel will converge at the hub to create an excellent model which seems to be the need of the hour with the looming healthcare problems in our society. I must mention at this point the particularly outstanding work done by Dr. E.S. Krishnamoorthy, who's been one of the 4 global advisors to WHO in preparing the report titled Dementia, a Public Health Priority. Dr. Krishnamoorthy has been engaged in other landmark publications, including development of a series of books which address the transcultural aspects of neurological diseases. He has chaired and addressed several national and international conferences, and notably the Epilepsy Society of Australia's keynote speaker at Hobart in Tasmania. Dr. Krishnamoorthy also completed a dynamic 3-year term as the Honorary Secretary of the VHS, laying the foundation for global development of the institution. And Dr. Suresh, a distinguished fetal medicine expert, has now been elected to this important position, and we welcome him and look forward to working with him in the development of the TS Srinivasan Institute at VHS. I am also happy to say that Dr. T.S. Krishnamoorthy will continue as the chair and continue to guide the T.S. Srinivasan Department or Institute at VHS. Now it's my pleasure to institute the speaker for today, our distinguished Professor Donna Ferriero, the 33rd orator, and to present her with the T.S. Srinivasan Medal and Scroll. Professor Ferriero is a professor of pediatrics and neurology and holds the chair of the Department of Pediatrics and is the physician-in-chief of the University of California, San Francisco Benioff Children's Hospital. She's the director of the Neonatal Brain Disorder Labs and co-director of the Newborn Brain Research Institute at the university. Her laboratory has been critical in defining the roles of oxidative stress during hypoxia ischemia and the relationship of selectively vulnerable populations of neural cells during maturation, dependent injury. She has been recognized at the university and by her residents as an outstanding teacher, receiving the Academic Senate Distinguished Teaching Award and the Robert Laser Neurology Teaching Award. She is active in mentoring programs for medical students, residents, and junior faculty, and she was recognized for these efforts with the University Chancellor's Award for the Advancement of Women and the Maureen Andrew Mentor Award from the Society of Pediatric Research. She is a recipient of the Holly Smith Award for Outstanding Service to the School of Medicine. She is a past president of the Child Neurology Society. She served on the Council of American Neurological Association and the American Pediatric Society, and is the past chair of the National Institute of Health NHSD study section. She is currently on the Council of NINDS. She is on the editorial boards of several peer-reviewed journals, which include Nature, Clinical Practice Neurology, Pediatric Research, Annals of Neurology. She is the recipient of the 2000 Sidney Carter Award in Child Neurology for Excellence and Leadership in Child Neurology. And she was elected to the Institute of Medicine of the National Academy of Sciences in 2005. She received the Royer Award for Excellence in Academic Neurology in 2007 and the Willis Lecture for Outstanding Contributions to Stroke Research in 2010. She was recently elected to the Association of American Physicians. I think all of you would agree that we are indeed greatly honored and gratified to have such an outstanding person to deliver the oration this year. May I now present her with the scroll and the medal. Thank you.
Good evening, distinguished Professor Donna Ferriero, Sri Srinivasan, Professor Krishnamoorthy, Dr. TS Krishnamoorthy, members of the Mr. Srinivasan's family, my own family members from VHS, members of the medical fraternity and friends. It's a pleasure to stand before you, and indeed I feel very humbled to be amongst such eminent people. Today is a day which we always look forward to every year, being the day of TS Srinivasan Endowment Oration. The TS Srinivasan Institute has been well known for its volume of research, creating a platform for sharing the latest ideas on the frontiers of neurological sciences, and this research always delivers the frontier in research with significant take-home messages. Doyens in the field have delivered this oration, and it is indeed looked upon as one of the major scientific events in neurology in the world today. Today we have a very distinguished professor of pediatrics. I don't need to say more because we have heard from what was said of her that we are indeed privileged to listen to her today in this hall. And she's going to speak to us about a very important topic, about the newborn with a very vulnerable brain, because these are the children who are going to be the future citizens of the country and the world. and it's quite important that we understand them at the stage and do what is required. If this oration has gone on for over 3 decades, this is largely due to the commitment of the family of Mr. Venu Srinivasan and the family of Professor Krishnamoorthy Srinivasan and his neurological team. Many of them I see there for a very long time. When I joined VHS 35 years ago, the same team has continued with him for so long. I indeed salute them for their commitment to this cause. And Professor Krishnamoorthy Srinivasan, as a student, as I was growing up, we all used to look up with him with a great sense of respect, because he was singularly responsible for putting neurology of India on the world map. And I also have the opportunity to congratulate him in a way that in a few days from now, he is going to be 80 years. And at 80, today in this hall, we have the youngest brain. He's extremely sharp. He can talk on a variety of subjects, and every time a 5-minute conversation with him, you take back so many messages, so much of clarity, so much of thought process. And I'm indeed very happy that I'm standing here and sharing the dais with him today. As Honorary Secretary of VHS, I should say VHS is very proud to be the home for this wonderful institute called the TS Srinivasan Institute. A few days ago, I had the opportunity of having a one-to-one conversation with Mr. Venu Srinivasan, and he shared his vision for this institute with me. And then I realized that what we are thinking of is not 1 year or 2 years or 10 years or 15 years. This is forever, that this institute should be one of the most important institutes in the world of neurology. And then adapt global criteria to local needs. And his vision of doing neuroepidemiological research is well founded, because today, as he says, with 1 billion population of India, we certainly can do enormous amount of epidemiological research to understand the disease in the way it should be understood. I thank him for being with us, supporting the institute, and I'm extremely happy and proud that the TS Srinivasan Institute is inside VHS today. I'm sure we are in today for a very good academic feast, and we will listen to messages which we will cherish for a very long time to come and apply some of these messages to our own practice. Thank you very much for a patient listening, and thank you very much for asking me to be here.